Hi, I'm Jolyn Wheatley, and I'm the District Social Worker for Jonathan Alder Local Schools. I'm here to talk to you about evidence-based programs that you can use in the school setting. NREP is the SAMHSA's National Registry of Evidence-Based Programs and Practices. To learn more about evidence-based programs, take a look at nrep.samhsa.gov, which is nrep.samhsa.gov. I wanted to first talk about the Signs of Suicide, SOS, which is the only school-based suicide prevention program listed on the SAMHSA National Registry. Suicide is the second leading cause of death for youth ages 10 to 19 in the U.S. Suicide prevention programs are an important part of student safety. In randomized control studies, the SOS program showed a decrease of 40 to 64% in self-reported suicide attempts by students. Schools that have implemented SOS report they feel safer and more prepared to manage suicidal behavior of students. The SOS program is a universal school-based depression awareness and suicide prevention program designed for middle school ages 11 to 13 or high school ages 13 to 17. The SOS curriculum includes lessons on raising awareness of depression and suicide, helping students identify the warning signs of depression in themselves and others, identifying risk factors associated with depression and suicidal ideation, and using a brief screening for depression and or suicidal behavior. That brief screening tool is called the BSAD, Brief Screen for Adolescent Depression. The BSAD has 7 questions. Students complete that. If they score as having moderate to high risk, then a trained school staff person would provide further assessment, and when needed, a student would be further evaluated by a mental health professional. We currently provide SOS to our 6th, 8th, and 10th graders in the district I work for. We collaborate very closely with Nationwide Children's Hospital. For more information about that program, please contact the Center for Suicide Prevention and Research at suicideprevention@nationwidechildrens.org. I also wanted to touch base on the Ohio Youth Risk Behavior Survey, which is part of a nationwide surveying effort conducted every 2 years in a sample of high schools across the state. This effort is led by the U.S. Centers for Disease Control and Prevention to monitor students' health risks and behaviors in 6 different categories. These categories include unintentional injury and violence, tobacco use, alcohol and other drug use, sexual behaviors that contribute to unintended pregnancy and disease, dietary behaviors, and physically inactivity. The YRBS is the largest public health surveillance system in the U.S. and the only reliable source of health behavior data for the teen population in Ohio. Ohio has participated in this YRBS since 1993. For more information, you can go to odh.ohio.gov. We have been doing some social skills groups in our school settings, and I wanted to just touch base on a few of the different curriculums we have implemented. Teaching self-regulation is really important to youth. We've used Superflex, which is a superhero social thinking curriculum that provides motivating ways to teach students with social and communication difficulties. The 3-part cognitive behavioral curriculum helps students develop further awareness of their own thinking and social behaviors, and they learn strategies to help them develop better self-regulation across a range of behaviors. And then we also incorporated zones of regulation. The zones is a systematic cognitive behavior approach used to teach self-regulation by categorizing all the different ways we feel and states of alertness we experience into 4 concrete zones. The zones curriculum provides strategies to teach students to become more aware of and independent in controlling their emotions and impulses, and it manages their sensory needs and improves their ability to problem solve different conflicts. We also incorporated what we call is yoga for classrooms. Our school counselors also implement some of these in the classrooms. It's an evidence-based yoga and mindfulness program for school that promotes social, emotional, and physical wellness, learning readiness, and positive school climate. The last thing I wanted to touch base on are programs that we have implemented through the Sandy Hook Promise organization. Sandy Hook Promise is a national nonprofit organization that was founded and led by several family members whose loved ones were killed at Sandy Hook Elementary School on December 14, 2012. The programs that we have implemented, one is the Say Something Week, which empowers young people to say something and save lives. Say Something Week raises awareness and educates students in the community through training, media events, advertising, contests, and school awards. Say Something Week reinforces the power young people had to prevent tragedies and protect a friend from hurting themselves or others. By building a culture of looking out for one another and reporting possible threats of violence when someone sees, reads, or hears something, the entire community will become safer and lives will be saved. We also did the Start with Hello Week, which is a program designed to bring awareness to social isolation and establish a more inclusive community. Start with Hello teaches students grades 2 through 12 the skills they need to reach out to and include those who may be dealing with chronic social isolation. We also incorporated No One Eats Alone Day during the Start with Hello Week, which is a student-led lunchtime initiative through Beyond Differences. No One Eats Alone is an event done in the middle school to make sure that everyone is included at lunch and students sit with new friends and classmates. So for more information on either of those programs, you can go to sandyhookpromise.org and beyonddifferences.org. Thank you very much.